Dr. Sandra Schneitz.
Well, thank you for that. Thank you for the introduction. As I go along, please feel free to interrupt me or stop me, and we can go back and talk about things. I don't particularly love to hear myself speak, so if we can avoid that, that would be great. I first wanted to thank my collaborators on these research projects. I'm going to talk about a body of work and then highlight a couple of studies. But I work with people in lots of interesting places, and all of them have contributed to this in some way. I also wanted to thank my other collaborators who were part of these processes, but not necessarily part of the research component. Lou Chavone helped us create some of the messages I'm going to talk about. He's one of the faculty here. We worked with advertising agencies. I work with somebody at the Center for Tobacco Products and also Americans for Non-Smokers' Rights Foundation. So tobacco control, it's sort of an interesting context. One of the ways that people in tobacco control think about why we do what we do is that the tobacco industry itself is a vector of disease. So we conceptualize the problem not as an individual behavior, but as an industry-sponsored sort of issue. So in the same way that we might think of mosquitoes carrying equine encephalitis and infecting people, we think of the tobacco industry as the vector of the infection of nicotine and tobacco use. Tobacco use kills lots of people. The current estimate is from the CDC is that 440,000 people die annually of tobacco-related diseases in the United States alone. Of course, if you look at that internationally, it's in the millions. The tobacco industry markets tobacco as a habit, but of course it's a highly addictive behavior. This is in some ways similar to other burgeoning contexts. So if you look at the way the sugar industry, for example, markets sugar-sweetened beverages or sort of other consumables that have negative health effects, tobacco, the way we think about tobacco control might be applied to those contexts. Part of what makes tobacco control so interesting is there are so many actors. So, industry lobbies impact the communication environment. There's legislation, there's regulation, there's the dynamics of the discussion online. There's all kinds of stuff going on that we can study in the broader context of tobacco. So tobacco control is also interesting because it's multi-level, explicitly multi-level, and that is the way tobacco control people think about it, but it's also the way that the policy and tobacco use environment occurs. So there's actually an international treaty that I'll talk about briefly related to tobacco control. The first international health treaty, by the way. There's federal and state level policies and also discussions that influence access to tobacco products. There's local level policies, local level decisions that are made, even related to things like how cessation services are provided. What's interesting about tobacco at the state and local level is that in some states the tobacco policies are preempted. So that means that the states mandate that localities cannot pass certain types of policies. Michigan is actually interesting because we neither have explicit preemption nor do we not have preemption. So we don't have good guidance, which is why tobacco policy at the local level in Michigan is often challenged in courtrooms. Then there's dissemination and implementation. So a lot of communication is focused on figuring out how to talk about stuff you know. There's a lot of that in tobacco control. If you think about the Real Cost campaign, I don't know if you've seen the CDC campaign, or the FDA, Center for Tobacco Products, has a youth campaign. There's a lot of anti-tobacco messaging in the world. There's a lot of interpersonal communication that happens around tobacco. If you look at social media and e-cigarette marketing, for example, and how people talk about that, how people talk about whether or not they want to quit. And then there's individual level issues. So, I mean, smoking is, for all that I think it is in many ways structural, still an individual behavior. So individuals choose to consume tobacco products. They choose to smoke and do other things. So I mentioned that tobacco is an international topic. The Framework Convention on Tobacco Control was the first international health treaty. It was adopted at the 56th World Health Organization Assembly in 2003 and has since led to a host of tobacco-related policies internationally. The US is one of the 2 non-signatories. Us in North Korea. So that's part of the reason that the tobacco control in this country is lagging. Because in most countries make an effort to match the recommendations of the FCTC, which includes things like taxation, not allowing the tobacco industry lobby at the table when you're making policy, different types of warning labels. There's a whole slew of recommendations in the various articles of the FCTC. Of course, tobacco control is a federal issue. The Master Settlement Agreement was a federal court case in 1998 that ruled that the tobacco industry was racketeers and allowed for things like the Truth Foundation. If you've seen the Truth ads, you know, that's funded by the Master Settlement Agreement. We also have the Surgeon General's reports. A recent one was on e-cigarette use among youth and young adults. There's, I think, another one that's come out. The Food and Drug Administration Center for Tobacco Products since 2009 regulates tobacco products. They should be regulating e-cigarettes. They're a little behind on that. But so a lot of this happens at the federal level. Of course, it also happens at the state level. The American Lung Association rates states on various things. This is tobacco taxes and how the American Lung Association feels that states should be graded. But you know, taxation is often a state level policy, though of course you can also have local tax. You notice that Michigan has very poor tobacco taxes. We have good smoke-free policies, not so good at the taxes. And then there's a myriad of local policy options that people sometimes can engage depending on their states. So that was a little bit about the tobacco control context. I want to give you a little bit of a context for my work. It's guided by a variety of conceptual approaches. I come from, believe it or not, a psychophysiology lab. So my early graduate work was hooking people up with electrodes to machines and measuring how they automatically responded to things. And I mention that because it's actually part of what led me into tobacco control. So embodied cognition is the perspective that our physiological experiences impact how we process information. And if you think about that in the context of an addictive behavior, it seems sort of, it seems related. And what got to me when I was doing these early psychophys studies in this lab was that if we're having automatic responses that are really impacting our choices and that affect our processing, then we have to change the environment, right? So to me, if you're a true embodied cognitivist who cares about health, trying to help people quit smoking by putting them in groups and giving them nicotine replacement therapy and all that is great, but we need to stop exposing people to the cues and stop exposing them to things that make them feel the need to smoke. And so that's part of what pushed me in the direction of sort of moving toward this more health perspective. And of course, then I moved to Penn, where I did my doctoral work, and I got introduced to this cue reactivity associative learning paradigm, which is that people who already have addictions react differently to addiction-related cues. And then I moved to public health. And that's a whole nother framework, right? And that's much more structurally oriented. So I started thinking about, sort of what are the structural things that impact people's behavior? And that's more like the social determinants of health, which is a theory that suggests that there are these sort of infrastructure issues that impact our health. Ecological models, there's lots of different ecological models, but again, it's this broader perspective. And so I study all of these things, but I can't seem to be able to come up with one study where I can use all the levels. Maybe someday, right? That's the dream. But my work as a body integrates a lot of these conceptual perspectives, and they certainly all play a role in how I think about tobacco control and how tobacco works. So what are my big questions that I generally try to ask with a series of sub-studies? One of which is, how does interaction with the tobacco industry impact health choices? So there are lots of ways people are exposed to the tobacco industry, through marketing, through bars, through sporting events, through watching other people engage in things. How do norms, and I define norms sort of broadly, I include things like laws in norms, impact tobacco use and perceptions? What is the interplay between physical context, social connection, and individual choices? So how does a person's context impact how they make choices about their tobacco use? And how can we as a tobacco control community most effectively communicate about tobacco products or about not using tobacco products? I use lots of methods. What this actually partly means isn't that I use them, but that I collaborate with people who use them. Although I theoretically know how to do all these things by myself, it seems more productive to have an expert on my studies instead. So I have led a number of papers using GIS. I use psychophysiological methods. I do some large data set analysis, reaction times, network analysis, even an occasional content analysis, which is where you sort of either qualitatively or quantitatively try to describe a corpus of things, and it could be tweets, it could be tobacco industry documents. There's lots of fun ways. But from a collaboration perspective, that means that there's lots of people I ask for help. I have ongoing conversations with people at NCI and FDA about what's important, what's coming down the pipe in terms of regulation, what we should be thinking about. I work sometimes with local health organizations. The director of tobacco control for Michigan is a former medical doctor. His name is Fareed Shamo, and I talk to him about state policies, what could be useful for them. I think about regulators. So the FDA actually does regulation. Sometimes you can also talk to state policymakers. And then, of course, I talk to people in all kinds of academic disciplines, and I work with people in all kinds of academic disciplines. Boy, when I practiced this, it was a lot faster than this is. So I'll try to speed up. So my work is relevant to lots of different levels of research.
They just need me to look at it, and then it went back to normal.
I'm going to talk about two of the more extreme cases. Sometimes I do work thinking about the physical or broader social environment. Here's a couple papers that I've been on that do that. And sometimes my work focuses on very macro things, like particular message features that impact processing. And so I'm going to talk about sort of both extremes. I do a lot of stuff in the middle, actually, too. But it turns out that you can't talk about everything in the whole world in 30 to 40 minutes. And so I like this. This is a weird paper, but I like this paper, so I'm going to talk about it. So we had a question of how does social capital and tobacco retail outlet density, how are they related? Well, so the first question is, what's tobacco retail outlet density? So tobacco outlet density, or TOD, is the density of tobacco-related outlets, for example, convenience stores, tobacconists, other places that sell tobacco in a given geographic area. It's usually within a half-mile or a mile buffer. So they take like a roadway buffer around a physical location and then create a number. TOD is actually really important because it's one of the primary sources of marketing exposure that people have to the tobacco industry. And so, unsurprisingly, exposure to more tobacco outlet density is associated with more smoking, almost always in adolescent studies. About half the adult studies find that. It's a little bit more variable in adults. In adults, it seems to depend a little bit on country, which makes sense because the marketing context varies by country. Higher TOD tends to occur in economically disadvantaged settings, so lower income communities tend to have more TOD. Think more gas stations and more convenience stores. We tend to see those more in those types of communities, and those tend to be the primary retail outlets. So our thought was TOD may be impacted by a community's ability to mobilize against certain store types. So it may be that communities that have more social infrastructure may be able to prevent themselves from having these tobacco outlets, because oftentimes they're undesirable stores. You know, the other primary tobacco outlet is either a bar or an alcohol, just some place to buy alcohol. So these are not necessarily places you want your kids to go buy. And so we asked, what is the relationship? And we would anticipate that social capital would be associated with the ability to mobilize. And so we asked, what is the relationship between TOD and social capital? So we did this in the context of a cross-sectional survey, a US representative cross-sectional survey of parents of teens. And so this is actually part of a larger project. One of the other papers had looked at some of the adolescent data. We linked it to calculated tobacco retail outlet density and proximity to homes. And we also had community demographic data from the American Community Survey, which was like percent below poverty, percent non-Hispanic Black, percent Hispanic, whether or not it was in a metropolitan statistical area. We had two social capital measures, which are not my favorites, but those are what we had. This is what happens when you're a postdoc and you end up collecting data with people. So shout out to postdocs. Informal social control. For example, how likely is it that one of your neighbors would do something if your kids were getting in trouble? Or trust in others. People around here are willing to help their neighbors. We asked these of individuals within communities, so it was their perception of how these things worked. And then we had some control variables at the individual level. So our analytic strategy was a multivariate linear regression, which was weighted to reflect a nationally representative sample of households. We had our predictive variables at the neighborhood level from the American Community Survey and social capital, and our outcome was TOD. We had some demographics. The thing I want to highlight is because we asked for parents, we got more women to respond than men. So this is not even weighted. It's not representative. But we tried. But I just, that to me is something that you should be aware of when you're thinking about this data. So Generally, when parental perceptions of trust were higher, TOD was lower. So that would suggest that there's this inverse relationship that we would have predicted. There was no relationship between the TOD variable and social control. And owning a home was associated with lower TOD. So if you think about it, owning a home could be a proxy for being in a neighborhood where there's more economic advantage because not everybody can afford to own a home. It's not always the case. But it's something that we were sort of thinking about. The percentage of residents in poverty and the percentage of Hispanics were positively correlated with TOD controlling for social capital variables. So there were some structural effects. The percent residents in poverty was sort of what we predicted. We weren't sure what to do with the percent Hispanic. We actually had this fantasy that the communities that were higher in had a higher Hispanic population might actually reflect ethnic enclaves, and those tend to have positive impacts on social capital. So that wasn't what we anticipated, but we did find the higher levels of trust with lower TOD. We hypothesized that this could be through collective action. We're using this as pilot data so we can collect a little bit more robust data, looking specifically at collective action and other questions. Social capital does not explain all rates of TOD. There are structural issues that impact it. And this is where tobacco control is an interesting problem. Interventions to reduce poverty may reduce TOD. And that's why public health is fun, right? Because a lot of the things that we see are actually social determinants of health issues. So even though we did find, increasing social capital could theoretically work through a framework of social action, there are also real structural issues that are leading to some of our outcomes, or at least that's what we think. I mean, again, this is one study. There's not other studies like this. We're trying to do other studies like this by getting funding, but it was an interesting set of questions. I do other work at the community level. We find things like adolescents who smoke more are more likely to visit convenience stores. We look sometimes at how policy framing impacts people's willingness to engage in policies or willingness to pass policies. And I also have done a couple papers with Maria Elena Gonzalez, who's my colleague who is also obsessed with policy, looking specifically at how smoke-free laws come to be. So how are they passed? What are the patterns of their passage? Sort of what's the context that they happen in? So that's another thing that we do. And now for something completely different. So that was at the very broad level, but then I'm going to talk briefly about some studies looking at actual message features and how they impact how people process messages. So we were funded by the National Cancer Institute to do a couple studies looking at just how vaping is when you use e-cigarettes. Anti-vape, yes?
I have a question.
Yes.
Before you start this part, did you say that you really could, I have a background in public health, so with the ecological model, you said you really couldn't find a model that fit everything, because what comes to my mind is the social ecological theory Daniel spoke of for health promotion, and it goes to those levels. Yeah,
no, I can't do them all in one paper.
Okay.
I totally agree that is a really good theoretical approach, and that's actually based on Bronfenbrenner's earlier ecological model. Yeah, yes, and I think about my work in that context for sure. And actually, I had that as an outline to this presentation, and then I took it out because it was taking me too much time to explain it. Because then I was trying to talk about the macro level and the meso level and all this other stuff. But yes, I think conceptually that's how my work fits in. And I think most public health works that way. Okay. So yes, absolutely. So what we did for this is we looked specifically at how a very small message feature, which is whether or not there is vapor visualized or visible in these anti-vaping messages, impacted how people process the messages. We did all the things. I did this with my friend Andy Tan, who's at Harvard. So we have two sites. We have MSU and we have Harvard. We had lots of outcomes. We had a main effects, message effect paper. We had a smoking topography study, so we actually measured how people smoked, who were smokers after seeing e-cigarette commercials. We did eye tracking, what are people looking at? And then a psychophysiological study, looking at how people process the messages. And the reason that I highlight this is because, oftentimes when we think about dissemination, implementation, or messaging, it seems like people do one study and that seems like enough approaches. But even within the context of D&I research, or dissemination and implementation, there's lots of different methods you can use to think about effectiveness. And this is just a small number of them, right? You could do focus groups. We did talk aloud protocols. You can watch people after they use the product. I mean, there's all kinds of things. These are the ones that we did because we only had enough money to do a certain number. I keep wanting to do all the things, and you just can't. So I'll tell you a little bit about the experimental condition. So we had 4 conditions. We had a couple of different controls, one of which was the anti-vaping PSAs with the vapor. Another was the anti-vaping PSAs without the vapor. And we made the PSAs ourselves with a local ad agency, and so they were virtually identical except the presence of the vapor. So it was a really good control. We had a physical activity PSA condition because we thought that would elicit arousal, and maybe that would be a good control. And then we had anti-smoking PSAs with smoking cues. So that was more like the with vapor condition. It was a between subjects design. There were 4 messages in each condition. We did pre-testing. Arguments were pre-tested in a sample of 130 young adults. I often do e-cigarette research in young adults. The reason for that is because young adults have one of the highest use rates of e-cigarettes in the US, aside from adolescents. And young adulthood is actually a really important period for consolidating of tobacco use behavior. So a lot of people try tobacco products during their adolescence, but they don't sustain use, right? So they'll like smoke for a brief period of time and then not. But during young adulthood, use becomes more sustained. And so if you're smoking at 24, the likelihood that you'll be smoking at 30 is very high. If you try cigarettes at 12, it's less predictive of long-term outcomes. And also, I don't really like working with adolescents. So let's be honest, it's a little bit beyond my ken. But from a research perspective, young adulthood is actually perhaps a more important period for tobacco use. So we pre-tested arguments to use in these messages. The 3 that were rated most highly, they were most memorable, they were most novel, people actually remembered them, we did some memory tests too, were about product constituents, ENDS, which is electronic nicotine delivery devices, e-cigarettes, as a gateway to nicotine, and ENDS as being addictive. So we created our anti-vaping messages to be similar to anti-smoking messages, and again, the vapor and no vapor were identical. We did all these things at various sites. I'm just going to highlight one finding. So we had a number of, tobacco control, you have a lot of outcomes you care about, right? Some of the outcomes are urge to use products. So we asked about urge to vape, urge to smoke. We recruited smokers specifically because we were concerned about cross-cue reactivity. That is, if you see a smoking-related cue, does it make, a vaping-related cue, does it make you want to smoke? Intention to use, so intention to vape, intention to smoke, and then intention to purchase e-cigarettes and combustible cigarettes. And then I wrote myself lots of notes about the statistical analysis we did. So compared to the so I wanted to highlight 1 or 2 things. Compared to the physical activity control, having no cue was associated with higher urge to vape, which is this right up here. But there was no effect in the vaping cue, in the vapor condition. The e-cigarette PSAs were associated with lower intention to vape in general. So here, as compared to our physical activity control or compared to the anti-smoking control. So the PSAs at least were working some. And the PSA with vapor was associated with lower intention to smoke, which was totally not what we thought we'd find, right? We thought we'd find cross-cue reactivity, and vapor looks a lot like a smoking cue, more like a smoking cue actually than the vaping does. So that was kind of comforting because we were worried that the anti-vaping messages that states had already created would be likely to create a boomerang effect. So that's great. We have a main effect study that tells us nothing about how it works, right? So then the next question is, what are the processes that are producing these effects? And we did this eye tracking study that I'm not going to talk about because it turns out you can't talk about all the data. But then we did a psychophysiological paper, and we looked at things like, how does vapor impact resource allocation? We thought maybe the vapor would increase encoding because people would be paying attention to it, that it would be more appetitive. So when I mentioned initially embodied cognition, the underlying construct behind that is that people experience both appetitive and aversive activation. So appetitive activation is what makes you move toward things, right? So if you see a really delicious looking cake, you're probably going to inadvertently sort of lean toward it, right? You're like, ooh, cake. But if you see something that's aversive, like a spider, my 4.5-year-old has been putting little Halloween spiders all over the house, you're going to sort of move away, right? And so appetitive appetite, we thought that the vapor would be appetitive for smokers because it would be a smoking-related cue. Even though we didn't find that in the main effect study, from the physiological perspective, we thought that has to be happening. And then the messages that contain vapor would be associated with arousal. So how do you measure those things? So tonic heart rate deceleration is an indicator of cognitive effort. We use percent correct on a force choice recognition item as an index of encoding. So we had sort of items, like sort of true or false items that they could pick from. We then ran a signal detection analysis that turned out the same as the percent correct. If you care a lot about signal detection, we can talk about it. Pretty much nobody does unless they do. Orbicularis oculi, which is your muscle under your eye. When you actually smile, your eye wrinkles. Well, that's the muscle that moves. And so you can use that as an index of positive affect. And then we use skin conductance as an operationalization for arousal. So when your palm sweats, right here, that's where we put the little sensors for skin conductance. And so we literally measure how much people's hands sweat. So the big fun finding was cognitive effort. So this is the time series of the messages. You can see, so here and here are where the vapor cues are. What we see is that there's greater heart rate deceleration and the vapor versus no vapor condition is a main effect. But also, the differences are greater when the cues are present. And so what that tells us is the cues are probably eliciting heart rate deceleration, which suggests that the cues may be producing the cognitive effort that we would have hypothesized they would be producing. And we found that when the vapor is present in a condition, the encoding is better. So they're doing better on these force choice recognition tasks. And that there was more positive emotional response. So that little eye muscle was being activated more in the vapor conditions. But there was no significant difference on skin conductance, which was surprising because you're seeing all this activation, but they're not having a lot of arousal with it. So this tells us that the vapor is activating the appetitive motivational system, which is kind of counter to what we would have thought in the other study, because we would have thought if that was happening, I'll go back to this. Oops, that was the wrong way. Oh no, I broke it. Give me a minute. Just a second. Wrong direction. Okay. We would have seen more, here we go. We wouldn't have seen this. So we would have thought that if there was more appetitive activation, we would see more intention to smoke. But we didn't, so that was really interesting. There's also some associated urge findings I'm not talking about. But what this study looks like is that the vapor is at least acting as an addiction-related cue physiologically, but it's not impacting their choices. And so there's this interesting interplay between the underlying motivational systems and the more cognitive systems. And that may be because we had strong arguments. So there's some research that suggests that you can counteract physiological responses by creating sort of strong arguments against use. And that may be what we had in this case. We hope our messages are effective, so that would be the dream. I do other research on message features. I have a paper in tobacco control looking at how claims on packaging impact intention to purchase. We have actually Andy Tan as PI on a grant that we worked on looking specifically at how vapor in e-cigarette commercials instead of anti-use, instead of public service announcements, impacts processing. And then one of the really interesting problems that I'm working on right now is you see all these e-cigarette commercials, but a lot of them have anti-smoking arguments. And one of the things that happens when smokers are exposed to anti-smoking arguments is that they have this thing called reactance. So reactance is this attempt, it's this very like arcane sounding psychological concept, attempt to reassert control after a message makes you feel uncontrolled. But really what it is people get pissed off when you tell them not to do things. And the problem is that these these pro-vaping messages have a lot of anti-smoking arguments. And when people experience reactance in the context of smoking messages, the thing they do is smoke more. And so the question is, are these pro-vaping messages eliciting more smoking behavior? And that's what we're doing right now. So we'll see, who knows? But let's go back to tobacco more broadly. Tobacco is an interesting context. I think of tobacco industry as a vector of disease. And so I think a lot of the things that we do need to be focused on structural issues. One of the big problems for me with a lot of tobacco control research is it focuses on individual behavior only. And though I think it's important to have messaging that impacts individual behavior, it happens in a broad context. People see smoking cues, people experience tobacco policies, people experience norms. And so we need to include all these parts of that context. One of the things I love about tobacco control is that our big national conference is completely interdisciplinary. So, I will sit on a panel with somebody from public health, someone from medicine. There's a lot of sociologists running around. There's people from economics. It's a very interdisciplinary group that works toward addressing this broader issue of how do we, what people call obsolete cigarettes. How do we create an environment in which people are no longer using tobacco products at risk to their health? And of course, I think communication people should have a seat at the table, right? Because that's what I think. That's why I'm doing this. There's lots of places where communication people play a role in this context. We can do work at the point of sale, thinking about packaging, advertising research, obviously. There's also portrayals of tobacco in entertainment media. There's a guy at Dartmouth who's not a communication researcher, but who could be, named Jim Sargent, who has spent his life doing this. Tobacco restricting policies. But I think where tobacco control is really interesting is there's this interplay between these social scientific concepts and these large contexts. And I think it's a good place in general where people can sort of think about these broader issues. So, questions?
Go ahead and
can you repeat the question when they ask?
Oh, yeah.
do you want to go ahead and take questions?
Sure, yeah. Yes.
I have a question.
Okay, great.
So I wondered if you maybe talk a little bit more about the structural issues
Yeah.
that you're finding. So I'm
Yeah.
guessing like the poverty and other
Yeah.
sort of like, and how, in particular, what I guess I'm interested in is interaction maybe between structural issues that you think are important and communication.
So
questions that are
yes.
especially interesting to you.
So one of the things that is really problematic about tobacco control is that we often don't include all the populations we care about in designing our messages. And so, for example, if you look at low-income rural individuals, so I did some qualitative data collection with a colleague over in sociology. And if you look at how low-income rural individuals perceive tobacco policies and tobacco communication, it's really different than what you would see, for example, in other qualitative data collection. And this is also a group that has been resilient to tobacco control policy. So low-income rural people have very high smoking rates in the US. And we're not good at talking to them about policy. We're not good at getting policy passed in those communities. We're not good at doing anything related to tobacco control. And so I think work that focuses on these communities, engaging them throughout the process of thinking about why don't these policies work? How do we talk about this? What are we missing here? What do we not understand? I mean, it was really interesting because we went through into these focus groups, but at the beginning of the focus groups, I asked people to fill out some standard survey items that we always ask people, like about their tobacco use or about, just, they came out of like the TUSCPS, the Tobacco Use Supplement of the Census Population Survey. So, well validated. And the response of almost all of our participants was, these items make no sense to me. Why would you ask this? It's a stupid question. And it's always good to start out with that, with a focus group. But I think that we're not bringing all of the important contributors to the table when we think about how to message and how to talk about things. And I think increasingly there's an understanding that community matters and that we need to engage with other groups. And so I think, there's a large cultural context that is supportive of tobacco use in a lot of rural communities. And we have to understand that before we can think about how to message or how to create policies or how to get policies that are actually implemented, and all of these things are problems. I mean, it's also true, so I also do some work, I'm sorry, I'm going off on a tirade, but I also do some work in LGBT young adult populations who actually have the highest smoking rates. So rural tobacco's high, LGBT young adults, especially bisexual and lesbian women, are just off the charts. And that's a different kind of complicated, because a lot of times in those contexts, especially historically, the only place to meet other, and our participants tell us this all the time, other LGBT people was at bars. And so you go to a bar and then you meet someone by bumming a cigarette. And that became a social currency. And the other complexity with working with that community is that they're very heavily marketed to by the tobacco industry. But a lot of people in the community feel grateful for that, right? Because they're like, well, but they were investing in our magazines and our Pride Days and our events when nobody else would give us the time of day. And so, like, fine, I might die of smoking. I'm probably going to die of a hate crime, so I don't see the problem. And so I think, you know, in contexts where we look at these high-risk populations, there's a really good sort of place for the intersection of tobacco control and communication, and also thinking about some of these community structural issues, because, you know, it blew my mind the first time I had a participant, and I have a friend who does focus groups like this, and he's like, of course you saw this, who said, but I like the tobacco industry. They're the only people that pay for our pride parades. And I was like, fair. Like, what do you say to that? That seems like a reasonable statement. I mean, that's not crazy. It's like, yeah, they're the only people who care about us. We should care about them. Of course, Philip Morris at least calls it projects, or initially called it Project Scum. So there's tobacco industry documents that suggest that the tobacco industry was investing in low quality populations, as they called it. And so they included LGBT in that group. And so when you say that, then you get a different response. But, you know, it's complicated. So I guess that's a roundabout way of trying to answer some of that question. Yeah?
So I suspect you started to get to the answer in everything you just said, but I'm really interested in the study you did on social capital.
Yeah.
And how you arrived at social capital. Because I imagine there's studies done on socioeconomic background, but social capital seems really interesting and different.
Well, so there are not as many studies on community level SES as one might hope. Our thought was, well, so there's the theoretical reason, which is that what we initially noticed, so we were in the process of doing these store inventories. So I was doing this work with somebody who does a lot of stuff looking at stores, and what we noticed from walking around all the places for weeks was that places that had a lot of tobacco retail outlet density had what seemed to be disorganized communities. So there was a lot of like broken windows, and this is the time when people were talking about broken windows in research, and and they had more cops, and they had more, things that look like sort of indicators of communities that are not doing as well in some ways. They had more trash, so we started counting the amount of litter we saw. I mean, like, just qualitatively, this isn't, I mean, we didn't publish it because it was just like, we were just walking around and noticing, like, oh, look, this place has 15 pieces of litter. How about the next place? And so we started thinking, like, how could we ask a question? So what contributes to that conceptually? Like, how do you get to places with more tobacco retail outlet density, have more trash, more broken windows, and more cops? And one of the explanations we came up with, because it wasn't just low income, right? Because you can have low income communities that are like pristine, and that happens in places. Like, so it was obvious that it was, at least qualitatively, it wasn't just that. And so we thought, well, what causes that? And it seemed to be like a, possible that it was a lack of connection, a lack of community infrastructure, right? So like we were in this one neighborhood, and there was this sort of community leader / elderly woman who was walking around picking up trash, and she was eyeing us because we obviously didn't belong there, right? Like, we were not people that she knew, therefore could not be trusted. So she of course engaged us, and she was like, oh, how are you? Are you lost? What are you doing here? And I had my card, and we were very, we were ready for this. We have a spiel. We were prepared. But one of the things we noticed from our experiences, neighborhoods that had people like that seemed to have lower tobacco retail outlet density. And so our thought was, maybe it's something about how people are connected socially. And there are short social capital scales. And so the other problem was that we could add like 35 seconds to the survey. And that was the rule. And so what can you ask in half a minute that might get at some of this? And that's how we ended up with social capital. I don't necessarily think it's the best construct, But I think that there's nothing else like it. I mean, like, I think this is the first study that's like this. And so I think it was worth doing. But I mean, the dream is that now that we have this and we have some other stuff published, that we could actually go in and ask a more sophisticated battery and think about things like, you know, level of civic engagement and do something that's focused more on a particular community to sort of look at how it changes over time and to do more sophisticated things, basically. Because it's not optimal, but I think it's interesting, right? It's sort of a weird question.
It's getting you more towards that idea of community, right?
Right. And one of the problems with tobacco control is we think of everything as this big physical infrastructure, right? So it's all about nesting in physical infrastructure. And sometimes we forget that there's like things that happen in physical infrastructure that are not physical. So people who study tobacco retail outlet density almost never think about, like, they might think about poverty, but they don't think about like church membership. And they don't think about all these other sort of social variables. So that's how we got there, is walking around various parts of California for weeks. Other questions? Yeah.
I have one.
Okay.
So this is a general question, maybe not related so much to the tobacco thing. But I'm struck by the range of different lenses you use to evaluate the impact of communication, tobacco-related communication. So psychophysiological studies and and studies involving social capital. I mean, you're using a lot of different lenses for making sense out of this. And so I teach a critical thinking class, basically, right? And one of the things that I want students to be perhaps a bit more sensitized to is the range of different techniques that people can use to influence how they think about things, how they think about the world, how they think about products. And a lot of what it seems to me you're looking at is involves effects that really operate under the level of conscious radar.
Yeah.
Right? So you're not,
Yeah.
And are there, in your view, are there lessons to be learned from the kind of research that you do? Again, this sort of multimodal research, you're looking at all sorts of different levels that could inform, say, critical thinking? Or if somebody wants to be more careful or more cautious in situations like this, are there lessons that can be gleaned from the kind of work you do that would be useful here?
So part of the reason that I try to employ multi-level, multimodal approaches is because I think that each approach provides a lens to answer a certain type of question. And I think that we get really good, and I'm talking about we in communication. This is a self-reflexive we for me. I think I got really good, or we as a field get really good at answering the questions that appear with our approach. And I think in the context of these big health problems, that's totally unacceptable because, it's always a hammer and it's always a nail. So, for example, there's a guy named Robert West who runs most of the tobacco control program in the UK. And so they have a uniform perspective on harm reduction that they espouse and write about. And what that means is that all their published papers say the same thing. And I find that to be very problematic because I'm worried that they're missing findings because they can't think about them. So one of the things that I noticed when I was working in a psychophys lab is all of the problems that I saw were about emotion. Right? So it's all about how you affectively respond to things. And the problem is that not all your problems are about emotion. And so to me, it is incumbent upon us as researchers to try and incorporate other various conceptual and operational lenses because they give us a way to ask different types of questions. And I think if we want to be successful at addressing big problems, we have to be able to ask questions from different angles. But I also think that that's challenging from a disciplinary perspective because disciplines have paradigms. I mean, one of the joys of being in communication is I would argue we don't have a paradigm. But that's not actually true necessarily of all disciplines. Like we don't know if we're coming or going, right? We've never, we take from everybody. And that's part of how I ended up getting a PhD in communication, right? Because when I did my master's degree, I was working with a sociologist, a psychophysiologist, and then some like weird health people. And I wanted to do something where I could do all the things, right? So again, a very roundabout answer. But it is to say that I think that using multiple lenses and multiple approaches allows us to answer really different questions.
So that maybe for a critical thinking student who's listening to this, processing this, would maybe one lesson be something like the range of study, the range of methods you use corresponds to the range of ways in which communication can
Yeah.
And so, I can't just be locked in on one way.
Right.
When I need to be mindful of it.
I mean, I think about an approach, either a theoretical or a methodological approach, as a way of knowing the world, right? And so if you only have one way of knowing, you're probably really good at that. And quite frankly, I am not as good. I mean, part of the reason I work with all the people is because I know I'm not as good at the thing, right? So like, when I write sociological papers, I write with sociologists because I know they're better at that. When I do medical papers, I write with people in medicine because I understand that they're better at their thing than I am. But, I can use lots of ways to approach problems. And so it's a balance. I mean, at some level, I'm a little bit of a jack of all trades. And of course, the counterbalance to that is, and therefore a master of none. And that's a concern for me, right? That's why I try to get feedback from, I go to conferences within disciplines to get feedback from the discipline. And but yeah, I think super specialized versus broad would be my feeling about it. Great.
So it was something that kind of seemed to run by and caught my attention enough that I had to write it down.
Oh boy.
And it had something to do with, you were saying that you have evidence for the ability of strong arguments to affect appetitive responses.
Yeah. So
the interplay with that is a critical question in ethics.
Right.
It goes all the way back to Plato and the horses and all. Right. The idea is that reason can do some stuff, but desire tends to overpower. What's the relationship there?
Yeah.
Could you expand on
Yeah.
that that you made?
So he asked about the balance between strong arguments and sort of message effectiveness. So there's a woman who did a study in 2009, whose name is Yahui Kang, who looked specifically at the impact of argument strength on. So she did a study of smokers, and she had messages that had strong arguments that we rate in various ways, and messages that had weak arguments, and anti-smoking messages. And she looked at how that affected their physiological reactions. And what she found, and there have been replication studies, but what she found was that messages that had strong arguments could suppress physiological and self-reported craving. Magic.
That's huge.
That's the win, right? And so the magic in creating anti-smoking and anti-e-cigarette messages is always to have the dream, is to have the cues because they get the appetitive reaction, right? So you're processing, and then the strong argument. So the thing they're processing is the argument you want. Like that's the gold standard for messaging, at least according to people who believe this. I mean, there's been, at least 3 or 4 replications. So I feel like, we find it in our data all the time, for example, but replication specifically of that study. And so so we see that. But of course, there are different contexts where that might not work. So if you're very, very heavily addicted, there's a scale called the Fagerstrom test for nicotine dependence. Your ability to be swayed by arguments may be less, right? Because your physiological reaction is so paramount. But for most smokers or most nicotine users, there is a relationship between argument strength and physiological and experienced craving.
How do you measure argument strength?
So there's a lot of different ways. There's a guy at UNC Chapel Hill who has this really complicated 16-item scale. But we tend to ask people, it's a 10-item scale, whether or not they find the message or the statement to be credible, whether it's novel, whether it's... The initial scale had to think about it, puts thoughts in my mind about quitting, but I thought that sounded crazy, and we get good validity without it, so we don't use it. novel, credible? Does it make sense? Do people, I mean, so we have them basically just evaluate. I mean, I'm sure that there are much better ways in ethics to evaluate arguments, but this seems to work, and the scale's been validated a number of times. And so we ask them this like 8 to 10 item scale about the strength of the argument, and then we put it in messages and we do some evaluation after that usually. So that's how we measure argument strength.
All right. Well,
thank you.
Any other questions?
Thank you.
And you're welcome to
things.
eat food and drink coffee if you want for a while. We'll remain here for another half hour. Awesome.